If you've ever walked out of an NCLEX-style exam thinking, I knew that content, but the questions just didn't make any sense, this video is for you because NCLEX is not testing how much you memorize, it's testing how you think. And once you understand what thinking like the NCLEX actually means, the questions stop seeming so random. Hi, welcome. I'm Dr. Sherry. I'm a nursing instructor, and every semester I work with students who tell me the exact same thing. I know the content, I know the material, but I keep missing NCLEX style questions. In this video today, I want to explain what thinking like the NCLEX actually means, why so many students struggle with it, and how you can start shifting the way that you approach questions. So before we get into what thinking like the NCLEX actually looks like, let me tell you why this matters. So one of the biggest mistakes that students make is assuming that the NCLEX is going to work like all of their exams from nursing school, right? And nursing school often rewards students with content recall, and NCLEX is a minimum safety exam. NCLEX is not asking who would be the best nurse in a perfect situation. It's asking whether or not you can practice safely as an entry-level nurse. A lot of schools try really hard to make their questions and make their exams really close to the NCLEX and making sure NCLEX style questions are asked using the NCLEX test plan. A lot of the times, nursing schools, sometimes we miss the mark. We're not right there on point, okay? So when students here think like the NCLEX, they usually think that it means that they're going to need to start memorizing more, right? More videos, more notes, more details. Sometimes they even think that it means choosing the longest answer, the most detailed answer, or the most advanced intervention. Let me just pause right here and drop a gem for you. Choosing the longest, most detailed answer is not always correct. Sometimes that is the wrong answer, and sometimes that's put there just to trip you up, okay? Now, those are not bad strategies, right? But they are just incomplete. So let's talk about what thinking like the NCLEX actually means. Before I walk you through these pieces, I just want to be really clear about something. These are not just random tips, okay? They're steps in a thinking process. When I approach an NCLEX style question, I'm not jumping around in my head. I'm actually moving through the question in a very specific order. First, I'm asking, what's going to keep this patient the safest? Then I ask, is this patient stable or unstable? Next, I ask, what has to be done first? And finally, I recognize the pattern that I'm seeing. Once you understand that all of these steps work together, the questions stop feeling so scattered and your answers become more intentional. Let's get into it. The first part of thinking like the NCLEX is actually understanding that the NCLEX always prioritizes safety over perfection, okay? It's not looking for the most impressive answer. It is looking for the safest answer. If an answer reduces risk, prevents harm, or keeps the patient stable, NCLEX pays attention. That's what they're looking for. So another major shift is learning to ask yourself one key question. Is this patient stable or unstable? Your stable patients are usually going to require assessment, teaching, or planning. Unstable patients require what? Action. And when students skip this step, they often jump to interventions too quickly. Listen, it's about priority and not popularity. NCLEX questions are rarely asking, what do you want to do? They're asking what must be done first, right? Priority means time sensitive. Priority means safety. Priority means what cannot wait. I want you to start noticing pattern recognition, okay? NCLEX does not repeat exact questions, but it does repeat thinking patterns. And once you learn the pattern, new questions stop feeling new. This is why students often improve quickly once this clicks. So when you see me break questions down quickly in short little videos, I'm not guessing. I'm running the question through the same filters every single time: safety, stability, priority, and patterns. Let me tell you why a lot of students are missing all of this, okay? Most students aren't failing because they are lazy or unprepared. They struggle because they were taught content without being taught how to apply it under pressure. Struggling with NCLEX-style questions, it does not mean that you are incapable. It usually means that this thinking skill has not been taught to you very clearly yet. So instead of asking, what do I know about this topic? Start asking, what's the safest thing to do right now? Slow down, read the stem carefully. Identify what the question is truly asking before looking at the answers. Thinking like the NCLEX is not a personality trait. It's a skill, and skills can be learned. You're not behind. You are learning a different way to think. If this breakdown helped you, I'd love for you to stay connected. You can subscribe here on YouTube for more long form explanations where I slow things down and walk through thinking step by step. I also share shorter NCLEX question breakdowns on TikTok, where this video was actually inspired from, so you can practice this way of thinking in real time. And if you are struggling with a specific type of question, leave it in the comments, because chances are if you're confused, someone else is too, right? Listen, you don't need to memorize more. You need to think differently. And that's something that you can learn. Till next time.